Welcome to Bringing Better Health to Life, brought to you by Conway Medical Center. My guest right now is from Coastal Orthopedics. Meet Dr. Billy Mills. And welcome, Dr. Mills, to the program.
Hey, Diane.
I'm glad that you're here, and we're going to talk a little bit about the spine and some new things in fusion, but I first want to talk to you about your background.
I'm a native South Carolinian. I was born in Prosperity, South Carolina, in Newberry County. I attended high school at Mid-Carolina High School, went to college at the Citadel in Charleston, medical school at the University of South Carolina School of Medicine, did my orthopedic residency there, which was 5 years, and then did a spine surgery fellowship in San Antonio, Texas. Then came back here and joined Coastal Orthopedics approximately 19 years ago.
Wow. So really, South Carolina, born and bred, as they say.
That's true.
So, Dr. Mills, let's talk a little bit about some of the folks that you practice with, because some of the doctors' names will be very well known because your practice has been around for a long time.
I'm in Coastal Orthopedics, and it's Doctors Haskin, Pressler, Wilkins, Watson, Elliott, Taylor, and Ramsey.
Very good. That's hard to remember.
I don't think I left anybody out.
You better not, right? Let's talk a bit about some of your specialty surgeries, because I know that each of the doctors at Coastal Orthopedics has their own area.
Yes, I'm an orthopedic surgeon, so I do general orthopedics when I'm on call and covering the emergency room. Say if someone breaks their hip or breaks their ankle, then I'm available to take care of that. But the majority of the patients I see in the office and my elective surgery is the spine. I take care of, most patients that I take care of have problems with either their neck or their lower back.
Let's talk about some of the things that you do with the spine, because am I not correct that most surgeries with the spine, doctors used to go in from behind and now they do some from the front?
That is true. Historically, when I first started doing this almost 20 years ago, the vast majority of the surgeries, at least in the lower back, was done by going through the back of the spine and opening up the muscles there before you can get down to the bony part of the spine, which protects the spinal cord. There are ways, though, particularly newer technologies available to us now, where you can actually go through the front of the spine. We've been doing it going through the front in the neck for many years, particularly when it involves rebuilding a disc, say for a ruptured disc or a pinched nerve, and it's done through a little small incision on the neck. These procedures, when I first started doing it, were usually inpatient, 1 or sometimes 2 nights stay in the hospital, but many times now, I would say the majority of them I do as an outpatient. But in the lower back, we do have ways now of going through the front of the spine. I do this as a team approach with one of the general surgeons or the vascular surgeons here in town, and it avoids splitting the muscles in the back, so it's a much faster recovery. The outcomes, I think, are better. Patients recover faster, and you just don't have all the pain that goes along with dividing and going through the muscles in the back. And many times the incision can be much smaller too. There are also some newer technologies that involve going right through the side, where you actually go in and rebuild the disc or the spacer between the vertebrae by going directly through the side. And again, you avoid splitting the muscles. It's a small incision. I think these procedures will probably at some point be outpatient also.
Before we go to the break, I've got to ask you this. When you first started in medicine and studying this specialty, I bet you had no idea you'd see this kind of advancement in your field in 20 years.
I really had no idea, and I have to say it's very exciting because it seems like every year there's a new technology available. Things keep getting better and better, particularly when it comes to spine. I've seen just dramatic changes in the technology. Patients now have options that years ago I would have said, you got to live with this, but now there are many options, and some of those patients that I would have said, I really can't help you. Now we do have the technology, we have ways of fixing things, and we can do it in a way that patients recover very quickly.
And outpatient too. That's
Yes.
amazing. There's more here on bringing better health to life, so don't go away. More with Dr. Billy Mills after this.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
This is Bringing Better Health to Life, a program brought to you by Conway Medical Center. My guest is Dr. Billy Mills with Coastal Orthopedics. We've been talking about the spine and other ailments involving around the orthopedic realm, but I want to ask him specifically about a story of someone maybe you worked on recently. I know that you have successes every day, but there must be something that happened recently with someone that you really know you got this person back to life.
Well, Dan, there's one gentleman that comes to mind that I guess probably about 6 months ago. He loved to play golf, and he was having a problem with his lower back that caused pain in his back and his legs. He had some issues where the nerves in his lower back that formed the sciatic nerve were being pinched due to spurs that formed in the spine gradually over a number of years due to arthritis, and it really was debilitating to him. He was used to being very active, like I say, loved to play golf, and he couldn't do that. And I was able to help him with a fairly new technology, something called an iLift procedure, where the spine is, the spinal canal where the nerves pass through is made larger so that the nerves have the room they need, and it involves putting a little spacer in there to hold that area open, and then putting a plate. It's a new device. It's called the iLift, I-L-I-F, and it's fairly minimally invasive. You do have to use an incision to do it, but the incision is fairly small. And it's a one-night stay in the hospital, and he's had good relief of his leg pain. He's back to playing golf. He actually likes to run. He's been able to get back into his running routine, and he's very, very pleased, and he was just a very satisfied customer.
I'm sure that you see people too all the time, Dr. Mills, who probably say to you, oh, I know I shouldn't be complaining. I'm getting older, and at my age, everybody has some sort of arthritis. But I know that you don't want people to blow that off. I know that there is help for people, and a lot of times people just feel like, oh, I'm getting old, and that's the problem. They need to see a doctor and see what can be done, because maybe there's still plenty of life to be had.
No, I agree. I am very much into fitness. I believe in a healthy lifestyle, and I really try to not so much preach to my patients, but I really try to get my point across that I really do feel that people can have a good quality of life well into advanced age. But there is only one fountain of youth, and that's exercise. And the more we exercise, the better we feel. A healthy lifestyle is very important. And a lot of patients that I see that are elderly, they're in really good shape, and just your age has nothing to do with whether or not you're a candidate for an operation. I think it's just your general health that determines that. And many patients that are in advanced age are definitely candidates for a lot of these spinal procedures.
We have about 2 minutes to go, and I just wanted to ask you a bit about osteoporosis and what you do in helping that condition.
We have exciting new technology for treating osteoporosis, in that in the past, a patient with a cracked vertebra would have the only option of maybe wearing a back brace. But now we have the option of a procedure called vertebroplasty or kyphoplasty, which involves running a tube down into the vertebra that's cracked. And it's Band-Aid surgery. It's done through such a small incision you can't even put a stitch in it. And this epoxy or grouting type material is injected into the crack in the vertebra. It seals off immediately, and most patients wake up in their recovery room saying that their pain is gone. So it seals the crack off in the vertebra right away. There's no reason to limit your activity, and it's done as an outpatient.
So, how fascinating. If anyone who is watching us is having any pain whatsoever in any of these areas, they need to contact Dr. Billy Mills.
Yes.
Thank you so much
Thank
for
you,
being
Diane.
with me here on Bringing
Thank you.
Better Health to Life.